You're listening to Little Rockers Radio, and today we're back chatting to Nataly from Wonderwoman Children. Hi, Nataly, how are you?
Hi, how are you going?
Yeah, I'm really good. We haven't spoken for months, but it's part two of our... don't you dare talk, I'm still talking. No. It's part two of our safety series, which is burns and scalds, which is a big topic, but we're going to do it really quickly, aren't we?
We are, and I'm getting excited because it has been a while, and this is obviously a really common topic that comes up in our family first aid classes as a concern. So very, very excited to be chatting to you again, and hopefully we can get through some questions. And if anyone or any of the listeners have any more questions, they're more than welcome to get in contact with me.
Yes, absolutely, and we'll give all the details at the end. But I was reading that burns and scalds is the third most common injury for babies and toddlers. Is that right?
Absolutely right. So burns and scalds is a huge issue for newborns, for teens actually, but your biggest age group is your 1 to 2 year olds, so your toddlers that are getting a little bit more curious and wondering what's going on. So we do find a lot of children that age presenting to the hospital and incurring burns.
Anything that we would not think of? Like when I think of burns, I think of, the stove top where we've perhaps forgotten to turn something around and the toddlers come and pulled the, boiling water off, or I think of the hot water running the hot water tap. What other, are they the main things? What other type of burns are there?
And that's such a good question because we do think of the most common things. So it's a hot cup of tea that's got pulled down by the tablecloth or the boiling pot of water on the stove. Let me tell you a few little stories because obviously I get some stories along my way. So USB cords hanging out of computers and your phone chargers that are plugged into the wall, children are found sucking those items and they can actually get localised tissue burn in their mouth because their tissue, in their skin is so sensitive. So that's one that's happening all the time. And most parents, once I mention that, look around the house and go, you know what, I've had my charger sitting in the corner of the wall for a really long time. Another story, which is quite horrific, that I heard the other day, and we go through these stories in Mama Mag as well in the article that we've got for the safety series, is I met this wonderful gentleman and he just moved overseas and bought his first home with his family, and it was an open plan kitchen. They were boiling hot rice and frying some chicken, and his son was walking around the kitchen and the whole stove fell on top of him, which is crazy. He had third-degree burns over his whole body, all because the stove wasn't latched properly to the wall. So it's important to really know what items we have in the house, how safe and how secure it is. So is the kettle close to the surface? Is, hot items or the stove secured to the wall? So knowing things that we have in the house are also in a safe spot. Let me share one more story actually with the hair straightener. So the mum was looking for the daughter, walking around the house trying to work out what's going on, couldn't hear her daughter, and obviously children mimic. And she walked in and found her child with the hair straightener over her arm. So hair straightener is a big one for little girls because we always, us ladies are the same. We keep it plugged in the wall and do a quick hair straightener and leave it, and they quickly learn how to turn it on. So lots of things happening. One more story, Sarah, I'm going to squeeze it in. Just as an example, is actually happened to me with my daughter. And she went through those tube slides that are enclosed. And as I walked towards the slide, I could hear her crying and this white dust just came flying out from the slide. And it turned out some people, we don't know who, poured chlorine powder down the slide as a prank. And she ended up with superficial burns all over her from a chemical burn. So we need to think about chemical burns just as much as the sun and heat as well. Yeah. So lots of terrible stories.
Quite a few things there that I really wouldn't think of. Hair straightener, yes, absolutely. The localised burns to the mouths from USB cords, phone chargers.
Electricity, yep.
Preventing burns is probably a little bit easier to cover because it's keeping an eye on all of the things that you just mentioned, making sure that we turn things off, keep them up. Any other tips and tricks there for us?
Education.
Yeah.
I always ramble on about education. Trying to speak to your children about what burns are and what they do, and it's really hard for them to understand what's hot. There's always a few little tips that mums have a go at. So if they're holding a cup of tea, they'll allow their child to feel that so they can understand what heat is. So there's little things that you can do, but education is probably the most important, and then letting them trying to understand, rather than it's always mum just telling them off, why is mum always telling me off, is trying to get them to understand, why we're so conscious about burns and why we have to be so careful.
Yeah, of course. And first aid management. So can you tell us how we treat burns, and can you tell us a couple of old wives' tales
Well, in my heyday, I certainly put some butter on my burn because my grandma told me to do so. And you often hear in European cultures when you have a sunburn to have a completely hot shower to take the sting out of a sunburn. So that's a few little funny ones actually that people still do to these days. Look, I think the most important thing to take away without me blabbering on too much is 20 minutes cool running water. And that's really, really important. It's more important than you quickly getting in the car and rushing to the hospital. Obviously, if you need help, always call 000, but the 20 minutes cool running water is vital. So if you think of a piece of steak, you flip it off the stove, it still continues to cook. The 20 minutes cool running water is for that purpose. So it won't really fix the damage that's done, but it's going to stop the continuing burn in the outside tissues of where they've actually burnt themselves. So often people say, well, how cold? The main thing that you need to remember is burns are extremely hot, so you just have to find anything cooler than that. So even warm, luke water would do the job with your 20 minutes cool running water. With the 20 minutes cool running water, you can do it up until 3 hours later. So if you've been a bit like me where I've burnt myself and then I had to quickly finish cooking dinner, it's still worthwhile half an hour later, especially for your pain management to stop the burn continuing, is to sit down and do that 20 minutes cool running water. A lot of people find it difficult to keep a toddler under a tap for 20 minutes. So as much as it's meant to be running water, we do have to think to ourselves, we don't want to traumatize them, especially if it's a minor burn. Introduce some water play. So, even though it's not running, just make sure it's cool water, get them outside, have a bit of a play with water. So that helps a little bit as well.
Yeah, of course. Okay. And call 000, as you said, if you need to.
Yeah, so there's a few key points. So anything under the size of a 20-cent piece, you can generally manage at home, thinking about pain relief and your 20 minutes cool running water. If there's a blister or open wound, you have to go see a GP. If you get anything larger than that, you have to go and seek assistance. Any burns to the joints, major joints, genitals or airways, you need to call 000 straight away. Okay,
all right. And all of that information will be on our website. And as you mentioned at the beginning of the interview, all of the information is also in this month's issue of Mama Mag, and you can find out if you're in Victoria or Melbourne, you can find out where Mama Mag is located. It's a free local magazine, mamamag.com.au. For more information, they can hop onto your website as well, which is wonderwomanchildren.com, and they can hop onto my website, which is littlerockersradio.com.au.
Wonderful.
Lovely.
Thank you so much, Sarah.
Thank you. Enjoy the rest of your week. That was Nataly from Wonderwoman Children on Little Rockers Radio. Thanks for listening.